I'm Candice Conzi, and welcome to Roycan's Natural Healthcare Center. I have Diane here that has graciously offered to allow me to show you what craniosacral is like as far as the treatment goes. So as I mentioned in the previous videos, it's a very light touch. It's only 5 grams, which is the weight of a nickel. And I'm actually going to feel the rhythm on the craniosacral, which is from the tailbone up into her head. So I've actually got an extra blanket here that I'm actually just going to slide my hand in between the blanket and feel the rhythm in her lower part of her back. Or I could dump you off the table, one of the two. So when I go right down to the tailbone area, what I'm looking for is the rhythm to see whether or not her rhythm is really nice and balanced. And in that particular area, if a person has some issues as far as digestion, because that's sort of where it comes into the spinal cord, or your sexual organs, the rhythm will be off a little bit. So I'm just feeling her rhythm. And it's not too bad. And so it's just kind of a nice rhythm like this is what I'm feeling. So then I'm just going to move up to here and feel the rhythm in her collarbone area and then her throat area. Just to sort of see, gauging for blockage. Then I move up into her head area, and we just sort of feel the rhythm here again. Now at the same time too, I'm actually doing a little bit of fascia balancing. So if she has fascia in her muscles and stuff that are kind of twisted through the pressure and energy from my hands, it'll actually start to relax. Do you feel that?
Oh, yes.
Okay.
I've had a little dead spot on the bottom of my foot. It's not dead anymore.
Okay. So we have acupressure points that go throughout our entire body. And so when you start doing these treatments, you're actually opening up some of those also. So now I'm going to lift your head, not you. So remember, the craniosacral is also going around, coming up through the spine here and going around the head. A lot of us hold our tension in between our shoulders and our neck. So right now I'm just releasing some of that with fascia balancing. Does it feel like your head's moving at all?
Mm-hmm. Mm-hmm. Feels like it's tilting that way.
Yeah. So her fascia is just releasing, and then now all of a sudden it's going the opposite direction. And then when it actually stops moving, then I know I can move into another position. So I'm actually just kind of going into the axial area of her skull here. And that can get really jammed. Then we have our various suture lines in our skull here. So we have the frontal one. So I'm just going to feel if it's in place. And a lot of times if it's not in place, that can cause some headaches. So through just a gentle touch, I can feel if it's in place, and if hers is. Then I'll go to the back of her skull here.
My sinuses are completely clear now.
Okay, so that released. Do you have any ringing in your ears at all?
I had before,
okay.
And but now I don't like.
Okay.
It's like when you try to equalize or whatever that's called,
right?
And your ears pop. That's just kind of what happened.
Okay. Then we go to our temples, and that's where a lot of people have headaches. And this actually joint here also, if your hips were out, this would be out. So yours is out.
Yeah, this side.
Yeah. So now my fingers are not moving. Do you feel like something's moving?
Yep.
Yeah.
It's going like this.
Yeah. So that's the fascia. So my fingers are not moving. I'm just following the energy to release. I find a lot of people that have foggy thinking, this particular area will be jammed. And once you release it, it takes the pressure and your thought process becomes a little clearer.
And could that be too, for me, because of the concussions?
Concussions, yes. And there it just went back into place.
Yeah. Because now my hip is not hurting either.
There you go.
But when you were doing it before, there's a little thing that was going like this.
Pulsing right there. Yeah. Okay, and so then we have our suture lines that are around our ears. And the one on your right side's a little stuck.
Mm-hmm. That's where I was having that headache on that side.
Okay. Yeah, so it can build up pressure. Here again, just releasing the craniosacral, doing a little bit of fascia balancing on top of it. And it's just released.
Okay.
So it doesn't take, it's a very, very light touch, but I can feel so much with the training that I've taken. Now she has energy totally surrounding her body, and so I'm in her energy field. So I'm just going to kind of pull it out. We don't want energy stuck to you. We want it to be out a little bit, so you've got a barrier. A lot of times when people walk into a room that's really a lot of negative energy, they will feel all of that tension and negative. And a lot of times it's because your energy field is not protecting you the way it should. You feel that pressure when I'm pulling it out?
Mm-hmm. And I could feel it resisting.
Yeah. It's a little stuck here. I'm just trying to, it should be out at least 3 to 15 feet. Like, there should be a bit of a buffer here. And there, I can feel it coming out. You've got your third eye here. So a lot of times if people have sinus problems or headaches or whatever, we've got to make sure that this opens up. And then I go back and I sort of feel her rhythm, her craniosacral rhythm, to make sure that we're kind of balanced a little bit more. I'm not going through all the steps, but just to kind of give you an idea. And then I go back, and so the craniosacral, the dural tube goes from here up to here, and so we want to make sure that the rhythm and the flow is really good. So I place my hand on the bottom of her tailbone, place the other hand just underneath her neck here, and feel that rhythm, and it's going to be going, the movement's going to be going from the tailbone up to her skull. And sometimes you feel a little bit of resistance. And then once you push it through, then that basically balances the person. There's a lot more to it. We're just kind of giving you a general idea of the fact that it's just a very light touch. It's amazing how you can feel afterwards. I just did a little bit on you. How are you doing?
And before I was feeling tired a little bit.
Right.
Now I'm not. My eyes are clear, like they were feeling puffy, now they're clear. And my hands are tingling.
Okay.
And that little sort of spot that I was having in the bottom of my foot is gone.
Right. Okay.
That's good. I feel energized now.
All right. So lots of things that craniosacral can help with as far as people's health goes. We're going to be doing a lot more videos on other modalities that we offer here. So stay tuned for further weeks of loading them up onto our website.